Bismillahirrahmanirrahim. Let's begin with the quote of the day. A good plan is like a roadmap. It shows the final destination and usually the best way to get there. The topic of my presentation today is planning models. I am Dr. Amna Khan. I'm PGR in community medicine. I'll be presenting this presentation under the kind supervision of Professor Dr. Saira Afzal. The learning outlines of today would be proceed model, patch model, match model, map model, chip model, the recent updates, and we'll be doing some MCQs so that we can have a better understanding of all these models. The learning objectives would be able to describing different components of proceed model, patch model, match model, map model, chip model. So let's differentiate what is basically a theory, and we should know what is the difference of a theory and a model. So a theory is a tool to help health educators better understand what influences health, explains how, why life happens, and it is developed over time. A model represents theory, framework for investigation, and the examples of such models would be patch, proceed, map, or chip. Let's start with the first model, which is the proceed model. The originators, Lawrence and Marshall Kreuter. The Lawrence screen first developed Proceed in 1974 and Kreuter added Proceed in 1991. This model is a framework of comprehensive health promotion education program planning. This comprehensive structure is used for assessing health needs for designing, implementing, and evaluating health promotion and other public health programs to meet these needs. Proceed provides the structure for planning a targeted and focused public health program. Proceed provides the structure for implementing and evaluating the public health program. Proceed is actually an acronym that stands for predisposing, reinforcing, and enabling constructs in educational diagnosis and evaluation. It outlines a means of for accurately diagnosing and planning a public health program for a targeted community. Proceed is an acronym for policy, regulatory, and organizational constructs and educational and environmental development. It facilitates the programs designed as a result of the Proceed process by guiding the implementation and evaluation of those Proceed programs. You can see here in this picture, there is a framework given, which is showing the proceed model, the different phases, which are basically total 9 phases here. So we will be describing all these phases in the next slides. So just to have an overview, you have 9 phases here. The first phase would be having social assessment. Phase 2 would be epidemiological assessment. Phase 3, behavioral and environmental assessment. Phase 4 has educational and ecological assessment. Phase 5 is about the administrative and policy assessment. Phase 6 is implementation. Phase 7 is process evaluation. Phase 8 is impact evaluation, and phase 9 is outcome evaluation. So let's start to understand the different phases here. Phase 1 is basically the social assessment phase. It defines the quality of life, problems, and priorities of the target population, involves the member of population in a self-study of their needs. Social indicators are absenteeism, alienation, crime, discrimination, happiness, self-esteem, welfare, and unemployment. The phase 2, which is the epidemiological assessment, it uses the data to identify and rank health goals or problems that identify in phase 1. The data is the disabilities, fertility, fitness, morbidity, mortality data, physiological risk factors, which includes incidence, prevalence, and so on. The phase 3 is the behavioral and environmental assessment, determining and prioritizing behavioral and environmental risk factors linked to phase 2 health problems. The behavioral is compliance, coping, prevention, activities, self-care, so on. Environmental, economic services, society, access and affordability. Phase 4 is educational and ecological assessment. It identifies and classifies factors that have the potential to influence a behavior. The predisposing factors are knowledge and traits. The reinforcing factors would be rewarding. These would be rewarding and feedback. Enabling is barriers created by societal forces. The phase 5 is the administrative and policy assessment. It determines if the resources are available to develop and implement the program, establish goals and objectives, precede ends. Phase 6 is the implementation. Select models and strategies of the intervention. Implementation begins. Proceed begins here. Phase 7 is the process evaluation phase. It is based on goals and objectives of phase 5. Measurements gathered during implementation to control, assure, or improve program quality. Phase 8 is the impact evaluation phase. The immediate observable effects of a program leads to the intended outcomes of a program. Phase 9 is the outcome evaluation, an ultimate goal or product of a program, generally measured by morbidity or mortality, vital measures, symptoms, signs. Now, let's understand the applications of the proceed model. So, basically, by applying these models, what we can do is coalition building, enhancing community participation, planning health education programs, planning multiple channel interventions, implementing health risk appraisals at work sites, planning employee assistance at work sites, influencing health work site culture, comprehensive school health education, improving self-care and compliance behaviors. So we should know what are the strengths of a model. So the strengths of the proceed models are popular and most researched model in existence for 4 decades, very comprehensive and covers all areas of planning. Initiation of the module utilizes community inputs and participation. Phased evaluation is also a strong feature. Limitations of this model: too comprehensive to be applied in a reasonable time period at a setting, requires heavy financial and human resource input to become functional, mixture of several theories, comparative studies lacking. We can understand this model better by quoting an example here. So the effect of proceed model on preventive behaviors for type 2 diabetes mellitus in high-risk individuals. So this is an example that can help us understanding better what is a proceed model. There's a planning phase, there's evaluation phase, and then we'll be implementing all those phases, and we can understand better the concept of proceed model. So in the planning phase is there, then we have the evaluation phase. We identify the administrative and financial policies needed, identify the ecological skills and ecology required. We identify the desirable outcomes, behavioral, environmental, epidemiological. Then the implementation process impact and outcome begins here. Planned. The next model is the patch model, which is the planned approach to community health model. The planning model developed in the mid-1980s by the Centers for Disease and Prevention, CDC, in partnership with state and local health departments and several community groups. Capacity building is a very important part of the patch model. Patch is designed to strengthen state and local health department capacities to plan, implement, and evaluate community-based health promotion activities targeted toward priority health problems. The key elements of the patch model. So what are the key elements here? Community members participate in the process. Data guides the development of a program. Participants develop a comprehensive health promotion strategy. Evaluation emphasizes feedback and program improvement. Community capacity for health promotion is increased. There are 5 phases of patch model. So these are mobilizing the community, collecting and organizing data, choosing priorities, developing a comprehensive intervention plan, and evaluation patch. Example of the patch model, in Baltimore, patch was implemented to improve the mental health among elderly people living in urban public housing developments. Health workers were trained to identify and refer residents who may need mental health care to a patch nurse. Psychiatric nurses with consultation and supervision from psychiatrists provided psychiatric evaluation and mistreatment in the residents' homes. Investigators evaluated the patch program to determine whether it is more effective than usual care in decreasing levels of depression and other psychiatric symptoms. Strengths and limitation of these models. Here are some of the strengths and limitation here. It's practical. user-friendly model for community health promotion and disease prevention planning. It is used in combination with other community-based planning frameworks such as assessment protocol for excellence in public health and health cities. It is employed to focus on the health needs of diverse populations to address topics like cardiovascular diseases, injury prevention, HIV, AIDS, and so on. Patch model has not been reported in literature in recent years and has declined in popularity. Now, the third model is the match model here, which is multi-level approach to community health. Intervention activities should be aimed at a variety of objectives and individuals. Match, we should know when we have to use this model. When behavioral and environmental risk and protective factors are known, when general priorities for action have been determined, focuses on program development. The match approach, the multi-level approach to community health. So we are going to study the phases now. The phase 1 is the goal selection phase. There are 4 steps here. Step 1 is the select health status goal. Step 2, select high priority target populations. Step 3, identify health behavior goals. Step 4, identify environmental factor goals. Phase 2 is the intervention planning. Step 1 is to identify the targets of the intervention. Step 2 is to select intervention objectives. Step 3 is to identify mediators of intervention objectives. And step 4 is to select the intervention approaches. Targets of the intervention actions. Individuals that exert influence or control over the personal or environmental conditions related to the health and behavioral goals. Levels of targets of the intervention actions: individual, interpersonal, organizational, societal, and governmental. Phase 3 is the program developmental phase. Step 1 of the phase is to create program units or components. Step 2 is to select or develop curricula and create guides. Step 3 is to develop session plans. Step 4 is to create or acquire instructional materials, products, and resources. Phase 4 is the implementation preparations. Step 1 is to facilitate adoption, implementation, and maintenance. Step 2 is select and train implementers. Okay, the phase 5 is the evaluation phase here. We have 3 steps. Step 1 is to conduct process evaluation. Step 2 is to measure impact. And step 3 is to monitor outcomes. Now, the MAP model here. MAP is basically mobilizing for action through planning and partnerships. It is a joint project of the National Association of Country and City Health Officials and the US Centers for Disease Control. It is a model for improving community health systems whose mission statement, communities achieving improved health and quality of life by mobilizing partnership and taking strategic action. So different phases is to organize for success, visioning, the assessments, community themes and strengthen assessment, local public health system, assessment, community health state assessment, forces of change assessment, strategic issues, goals, and the action cycle. How do you conduct a MAP process? Understand and use the guiding principles, system thinking, dialogue, shared vision, data, partner. MAP focuses on strengthening the local health system. MAP increases the visibility of public health in the community. The MAP process creates government leadership on public health issues. MAP takes a community perspective with the overall goal of creating a healthy community. Community health improvement process. CHIP is slightly different from other similar processes in that it incorporates accountability into the planning, implementation, and evaluation of the community health improvement efforts. How we implement CHIP. Define health broadly, develop scientific quantitative measures and hold responsible groups accountable to them. Balance long and short-term goals. Include all stakeholders and other potential contributors to the work in assessment, planning, and implementation. Include all stakeholders and other potential contributors to the work in assessment, planning, and implementation. A CHIP should be centered in a community health. So here's the cycle. First, we have to do the problem identification and prioritization cycle. We have to do the problem identification and prioritization, prepare and analyze community profile, and form community coalition, identify the issues here, analyze the issues, inventory sources, develop strategy, identify the accountability, develop indicator set, implement strategy, monitor process and outcomes. So the problem identification cycle focuses on beginning community stakeholders together in a coalition, monitoring community level health indicators, identifying specific health issues as community priorities. Now we will be seeing the summary of all the models here. The proceed model is medical perspective to public health, focus on health promotion and community participation. Patch is community health planning model, application on local level assessment function. Match is multi-level approach to community health, focus on the program's development. Map, it is targeted to communities, goal is to equip with structured framework for planning health programs. And CHIP is a process for building community health. It provides the way you improve community health. Time for the recent updates. A study of effect of educational intervention based on proceed model on diabetes and blood pressure preventive behaviors in patients referred to selected comprehensive health centers. The proceed model is known as a suitable method for preventing high-risk behaviors in individuals. The present study is an attempt to determine the effect of educational intervention based on the proceed model on the diabetes and blood pressure preventive behaviors in patients referred to the selected comprehensive healthcare centers in Shiraz city. This study was conducted as a clinical trial with intervention and control group, pre-test and post-test. The results also indicated that the mean source of the participants after the intervention in all dimensions were significantly improved after the intervention, showing the effect of the proceed model. The proceed model as a tool in public health screening, a systematic review. The proceed model provides an excellent framework for health intervention programs, especially in screening context, and could improve the understanding of the relationship between variables such as knowledge and screening. Given the complexity of a behavioral change process, certain important predisposing factors could be measured in future studies and during health intervention planning. Here are the references for my presentation. Now, time for the MCQs. Which health planning model uses a framework to provide guidance in planning a health program and a framework for identifying strategies to address factors linked to outcomes of interest? A, comprehensive health education model, B, patch model, C, match model, D, proceed model, E, classic model. Anyone?
D?
Yes, it is D. It is proceed model. The next one is the educational and ecological assessment phase of proceed model includes determining A, predisposing, reinforcing, and enabling factors, B, educational strategies, C, genetic and environmental factors, D, health and policy strategies, E, environmental factors.
D?
No, that is A. We discussed in the earlier slide as well. These factors, the predisposing, reinforcing, and enabling factors are the factors that would be used for the assessment phase of the proceed when we have to do the ecological assessment. The third one is the matching appropriate strategies and interventions with projected changes and outcomes occurs during which phase of proceed model? A, the second phase, epidemiological assessment, B, fourth, administrative and policy assessment, C, fifth, implementation, D, eighth, outcome evaluation, E, sixth, administrative and policy assessment.
C?
No, it's D, the outcome evaluation. Refusing to wear a seat belt because friends will tease you is an example of A, reinforcing factor, B, enabling factor, C, predisposing factor, D, strategic factor, or E, environmental factor.
A.
No, that's B, it's enabling factor. Which of the following planning models support intervention activities aimed at a variety of objectives and individuals? A, CDC model, B, proceed, C, multi-level approach to community, D, mobilizing for action through planning and partnerships, and E, general model. That is C, multi-level approach to community health. Now, number 6, which of the following focuses on programs delivered by public health professionals with responsibility for health communication? A, CDC model, B, proceed, C, multi-level approach, D, mobilizing for actions through planning and partnerships, or E, the patch model.
A.
Yes, it is A, CDC. Number 7, all of the following program models focus on linking the community's local health departments and the state level health department, except patch, match, proceed, CDC, or CHIP. That would be C, the proceed. 8th is in proceed, phase dash, which seeks to subjectively define the quality of life of those in the priority population is called dash. 2, epidemiological assessment. 3, behavioral and environmental assessment. 4th, administrative and policy assessment. 1, social assessment, or E is the social assessment.
It's A.
That is D. Which of the following planning models supports intervention activities aimed at a variety of objectives and individuals? A, CDC, B, multi-level approach, C, model for health education planning, D, proceed, or E, the classic model.
It's like A?
No, it's B. It's multi-level approach to community health. 10th, which planning model was designed to be used when behavioral and environmental risk and protective factors are generally known? A, CDC, B, proceed, C, multi-level approach, D, mobilizing for action through planning and partnerships, or E, the patch model.
C?
Yes, it is C, multi-level approach to community health. Here's the key. Here's the link of the YouTube channel. Thank you so much, everyone, for your time.